trying to deliberate based on the information that we heard. So I think I'll just start a list. Sure, Senator Petty.
Okay, I'm gonna bring up an item for discussion, and that would be the 988 Crisis Hotline.
Good. I think we have staff that might have some extra information on that because there seemed to be some duplication. I put my mic closer. Can you guys hear me on WebEx? There's that better. Okay. Okay. Sarah Petty brought up the 988, and I believe I had a meeting with staff a little bit about clarifying the amount of money that was put in both the DCF as well as the KDAD's budget. And there was money put in for both. So can you clarify what's paying for what? Turn them all off. Nope, there's Scott. Hang on while you guys are figuring out who's going to answer it. I got to grab another document. There I am. Need to turn my mic on. Sade or Matthew, did you hear the question about the 988 line?
Certainly.
We have funding in both the DCF and the KDAD's budget.
So my understanding is that while they are related funding for a similar item, that the funding that is in DCF, I believe, is more geared towards children and that sort of a population, while the funding in KDAD's is for more a similar 988 services, but for adults, so that they're essentially serving two different populations, while similar services, just two different populations.
Senator Petty, did you have more questions? Is your mic on?
Just turned it off. No, Madam Chair, I don't believe either one of the sources that Matthew's referring to would go towards making the 988 emergency line fully functioning.
Would the agency like to answer that question? Is that your question about that it's not enough to get it going?
I don't think there's funding for that to get it functioning.
Senator, can you hear me? This is Secretary Howard. I'm having trouble with my camera, but yeah, what's in the two budgets is the funding for mobile crisis response for children in the DCF budget, for adults in the KDAS budget. In terms of actual functioning of 988, there will also be costs to the state that relate to being able to answer all of the calls that come in. You might recall testimony about the fact that, for example, today not all Kansas calls coming to the suicide hotline are answered in Kansas. So there's a whole series of things that that in conjunction with 988 would be put into place. And those are all reflected within legislation that's been introduced and is being considered through the health committees with funding sources suggested connected to telephone bills. So again, the funding specifically in the DCF and KDA's budget right now is specifically related to the mobile crisis response. So it links to 988. You have to have someone be able to respond when those calls come in, but it does not complete every change that would need to happen for 988 to be fully operational in Kansas.
Yes, it does.
You have another item? Senator Petty.
Yes, I do, and that deals with the IDD waiver rate increase.
Which is the one that we passed last year.
Correct.
That was allotted.
Yeah, that was one of the allotments.
I'd like to go to the Senate position last year.
What was that number? I'm sorry.
7%, 5% for 2021, and another 2% for 2022.
Did that have a fiscal note?
It does. As soon as I can find out where I wrote that number down.
Is it 9 million? Ooh, is that more? That much?
Hang on, I got too many papers here.
Well, I had down 9 million, but I
9
think it's,
million is for the 5. There we go. The 7 would be 12.4 million. And the 60/40 FMAP split. Told you I was going to spend some money. So let me just explain this a little bit. As you all know, we don't need to go through this because we've heard the testimony, but these are people that are making $10, and if you do the math, we're really not making a significant impact in this area. And we saw a number of different entities testifying on this item and in this area. And these are not only people who are paid to take care of vulnerable individuals, it's family members who give up their career also as well to help in that system. I'm guessing that the House may come in a little less than that, and so I'm just looking at an area to where we could do some negotiation. Now, what I'll do, let's go through all the possible asks and tally, and then we can go back and see how much we have decided to spend, okay? Is that all right? Okay. So that is one proposal there, and let's continue to take a look at the different other proposals that you might be wanting.
so I will, since I brought up the 988 crisis hotline, I didn't say the amount, it was 3 million.
To make it functionally running.
Yes, in 22.
So that's something you would like to be considered.
Yes. Well, it's a, you know, I mean, it's, if we're going to be if we're actually going to be able to be part of that 988 suicide hotline, we're going to have to put in some funding to make it functional.
Okay.
And Anyway, 3 million is,
That 3 million is going to be 21 or 22?
well, like, 22.
All right. Ember Hope, we had the 1 million in there for the PRTF pilot program. Seemed to pass both sides with no problem. They're continuing to work on their PRTF. The other existing program that they have, this funding would be used for 12 more PRTF beds. And this was a program that was allotted, so I would make them, well, I'm not going to make a motion. I'm going to make a suggestion. We'll make the motions at the end. $1 million for Ember Hope. Okay, we'll come back and go back up. Since we're writing a lot of checks, we probably better come back and maybe tear a few up, so. Rachel, I thought I saw her. Yeah, you're here. Could you speak to us a little bit about the nursing home debasing and then the nursing facility daily rate increase? And what the difference is and... Yeah.
Am I on now? Here you go. Rachel Monger with Leading Age Kansas. And yeah, we were asking for two separate things there. So the rebase is something we ask for every year, which is in statute, which is updating the cost reports, and we want it to be 18, 19, and 20. I know we gotten a little bit of pushback on that because 20 is an anomalous year, but as I pointed out in my testimony, that's actually something we need because going forward, we will keep having elevated costs for COVID-19, testing, supplies, all kinds of stuff, and staffing. The second thing we are asking for is we know the state has the increased FMAP to be used for Medicaid programs, and we would like that to also be used to help nursing homes with expenses dating back from January to the end of this year, because it is something that we will continue to need, and federal provider relief funding that has really kept us afloat during the pandemic is being phased out throughout the rest of this year. So we would like to be able to cushion that, what we would think of as kind of a steep cliff for our providers.
So how come you don't get I guess because the governor decides how much you get of that FMAP increase?
Yes, and man, I hope I'm not wrong about this. My memory from last year when we got the CARES Act money, I think you saw in the KDAD's presentation, it was ended up being about 33 million. It came from the CARES Act dollars. And my memory is that the governor said that we're not going to give you the FMAP. Instead, we're going to give you this money out of the CARES Act fund.
Okay.
Yes, we got it, but of course, well, last minute they extended it, but as far as our members were concerned, it had to be spent by the end of 2020. It got extended last minute, but most of our members had already scrambled to spend it by the end of the year or had already turned it down because they didn't think they would be able to spend it by the end of the year.
So, so you want the CARES Act money and the FMAP increase as well? Is that, I mean, that's what you're asking for, right?
We got the CARES Act money last year. We would like FMAP money this year. Mm-hmm.
and I mean, not to, be negative, but we know with the CARES money, everybody thought that they had to be spent by the end of the year. It wasn't a decision that the state made. It came from the feds saying, hey, at the last minute, you can extend it. And so everybody was impacted by that the same way.
I guess just my point was that that's been spent. That
Well,
it's not.
and I don't know what you spend on, you were talking also about you want more PPE for next year. I mean, I'd guess if I had to spend a bunch of money, I would have bought a whole bunch of PPE because I wouldn't know what else to spend it on.
Yeah, and we used so the biggest outbreaks we had were in the fall and at the end of the year, so a lot of that was burned through.
So you are more interested in the daily rate increase recommendation over the debasing?
Long-term, we're more interested in the rebasing to make sure that those costs keep current and that we're able to provide a longer-term cushion when it comes to COVID-19. But we do also think it's fair to use that FMAP money on the providers who have been the most affected by COVID-19, which is where it's supposed to go.
Have you been following any of the next stimulus package?
Been trying to, yeah, especially through our national association.
Are you guys in it?
There are some provider relief funds, not to the same extent, and I think that that's been kind of a point of disappointment for our national associations and how much we've been able to get in the new relief packages.
So I got several documents here, so I don't know whose I'm reading, but your request for the daily rate increase that you did receive was how much, or you did not receive?
Oh, in 2020? That was a CARES Act, went through, that CARES Act Relief Committee. They're the ones, yeah, Spark, thank you. Spark gave us I thought it ended up being the 33 million last year.
To help you increase that daily rate?
Yes.
Okay, okay.
So did that 33 million, did that come into play into the deficit in their Medicaid funding?
Yes, that certainly helped us because, yeah, we went in with about a $30 million deficit, so that helped float us some more during the pandemic.
So then you wouldn't have, so if those numbers, I'm looking at this, that the estimate was 731 million was required to fully fund nursing home rebase. And you had mentioned, and they were given 703 million in the state budget. If you got the 33 million, so then actually, 3 million is not a lot of money, but you didn't come out underfunded for 2021 with the 30 million, with the 33 million, correct?
Never thought, I'm just thinking about it right now, but I guess we did kind of come out even. Although you would hear from providers that coming out even isn't so great when it comes to the Medicaid reimbursement, but especially in an emergency.
So the 33 million from CARES was, I was gonna say for a whole year, it actually wasn't a whole year. It was from half a year by the time we finally distributed it to you. Well, just for the ledger and to keep things moving. The nursing homes would receive 20 million, they'd get a $20 increase for the daily reimbursement rates. Is that correct?
Yeah, when we did our
20
CARES
million
Act, it was
SGF.
I don't know, I can't remember what the
Okay.
SGF was, I'm sorry.
Do you remember what was the daily increase per?
It came out a little under, I think, but it was supposed to be around $20 per resident per day increase.
Well, we can come in under.
You're saying 20 million?
That's what it'd cost to give them a $20 increase for the daily reimbursement. We could just do 10 and hope that everybody's got their warehouse full of PPE. Do you have a suggestion?
10. We're gonna.
So 10 million SGF, which is $10 per day. For nursing home facilities. And not do the rebasing. I think, talk about these extra subcommittee hearings you want to have, that's what we need to, that's the stuff we need to be looking at. Sarah Petty. We need to make that list, I guess. I don't have any more questions for you. Thank you. All right, what's next? Well, we need to talk about the name of it. It has to do with is it the BI waiver? Right, but the one that, yeah, the TA reimbursement rate increase. This is the one where it increased the salary for the in-home Medicaid care registered nurse, practitioner nurse services. The offset is the savings that you receive by not being in the hospital. This was asked for last year.
I'm sure, did we raise that a year ago? Oh, no, it wasn't at 27, then we went up to, or was it 2 years ago, we went up to 31?
We did, and was it allotted, Matt?
No, not the 31, I don't think that was allotted. That's our current, 31.56 an hour is that's the lowest reimbursement rate in the country, but that's our current rate. But what we're at, 27?
Amy, do you want to come up and answer?
Amy Campbell, representing Craig Home Care and Maxim Healthcare and Thrive Pediatric Services. Yes, there was rate increase. I believe that was several years ago. That was before my time.
Okay.
And we continue to be at the bottom.
So Matt, maybe you can tell us. I just refresh our memory on, did that make it through the budget at all? We did a small increase. It wasn't the level that they wanted, but then I thought it got allotted. That's what.
Last year was on the table, but didn't survive the
It did not
pandemic break.
process. Okay.
Madam Chair, if you wanted me to touch upon that, it was 31 and then you raised it to 37 and then that was allotted.
did make it. Okay. And they're requesting 47.
So, Madam Chair, so we had 3 suggestions of strategies. Do you have that in front of you from Maxima? It's on the back of it. It's on the back of that Maxima. Yeah, right in the middle of the page.
I think the big deal is we need to figure out how we capture those cost savings, how we can accurately do it, and make sure we do it before we totally jump in. How would that work, Matthew, about the transfer of the KDHE Medicaid budget? Would that come out of the MCO to pay an offset?
I'm sure I asked that just for a little clarification. I'm not quite sure what you're referring to. And
You have this sheet. It's the maximum.
I don't believe.
You don't? Okay. So one of their suggestions was the legislature could request a caseload transfer from KDHE Medicaid budget to KDAD's budget. This could make the cost of the increased revenue neutral or close to it based on cost savings from reduced hospitalization days from the SMC patient population. I'm just kind of asking logistically if we can do that.
On that, I'd have to get some more information and get back with you on as to what the feasibility of that would look like.
As a secretary, she's not from KDHE. I just curious if she has an opinion on whether that can happen or not because of her years of experience here.
Yeah, Madam Chairman, I think it's really difficult. I mean, we've been around and around on this, talking with our KDHE partners over the last couple of years. And I think back to a couple of different Medicaid directors, including our current budget director. And it's just been really difficult to get to, gosh, one can specifically tie this increase to specific savings on the other side of the shop. I think we've tried to go around that block several times, and I don't feel like we've been successful with that, to be perfectly honest.
Yeah, I know we've talked about this now a couple of years, but I guess it doesn't sound to me like either agency has really tried to figure out how we could do that, how you could measure that decrease with cost savings. And maybe you just can't unless you get it to the rate that they suggest to be able to figure it out. But in the meantime, we spend a lot of money trying to find out whether we're right or wrong. If we're wrong, we spend a lot of money. So all right, well, we can either do nothing or we can put the allotted amount back in just to be a placeholder. Want to do that?
Yeah, I would say that's the part I did like about this, the fact that you can't prove we're making these savings. But I would be supportive of something.
I think we can put the allotted amount back in, and then we need some language to move this ball forward to find out some kind of a way to measure this. And I'm not sure, that's going to take some time with an analyst to draft that, so. And, you know, I'm just making this new list now, Senator Petty's suggestion. I don't know if Senator Kirshen's going to like it, but after we're done, I think we need to have a few subcommittee hearings on these topics, on specifically just the few items so that we can dive into that.
Remind me again, what was the allotment that was cut?
What was what?
On the specialized medical care rate increase, what was the allotment that was cut last year?
Matthew, what was that number? On my allotment page.
It's on page 154. It looks like it would be 6.4 million all funds, 2.6 state general fund.
2.6 SGF?
Yes.
All right, let's put that back in. Anything else? What about the community mental health grant funding? $2 million.
They did get CARES money, and they were kept constant for 2022.
CARES money in that area. Amy, can you speak to that?
So, Madam Chair, I believe that, and Amy Campbell, Kansas Mental Health Coalition, I believe that Kyle Kessler testified in his testimony, he specifically spoke about the allotments. There was the percentage Medicaid rate increase that was allotted. I think it was a 2% increase. And then there was $2 million for CMHC grants that were allotted. So they did receive CARES money. Of course, that went specifically towards providing telemedicine services, and getting equipment up and running on all of that. But the $2 million for their grants would be basically base money for running their programs. So it would be kind of a different purpose.
So the other was more for telemedicine.
Well, the CARES money, of course, had to be spent. It couldn't be used for your base budget. It had to be spent for crisis utilization. I don't mean crisis, I mean providing services during the pandemic, PPE and all of that.
All right. $2 million. And then based on the modernization of mental health, the new focus on behavioral health, I also see that the SUD grants were cut, 250,000. And then the regional mental health beds, Secretary Howard, can you speak to that just a little bit, how cutting that has impacted this regional effort of trying to move forward?
Yeah, in the current fiscal year thus far, Senator, it's not impacted our ability to move forward. We currently have the 2.5 million was allotted, leaving 2.5 million. Add to that 3.9 million that was already in our base budget related to OSH diversion. So that's $6.4 million related to regional beds. We've had some delay in getting those going, but we currently have had Prairie View enroll as a provider for regional beds, and we just had an application this week from KU in Wyandotte County in terms of regional beds, and we're continuing to reach out to other hospitals. So at this point, that allotment has not had an impact. I think as we move forward into future years, I think we'll have to see what that looks like at that point. But at this point, we have $6.4 million related to the regional beds and are progressing forward.
I would go back to, you just mentioned the community mental health grants. And so if you are actually putting that on your list, then I would hope that we would speak to that being, I just had this page and I turned it, tied to the, because you said about that it being tied to certified community behavioral health clinics. That's what the grants are going for. I hope we would express support for Senate Bill 138, which is the certified community behavioral health clinics, and that was the number one item that came out of the mental health modernization.
SB 138.
Mm-hmm.
And then Secretary Howard, again, can we get reassurance? You said that, I'm making sure this is the right, I may not be in the right area, but the Meals on Wheels,
The nutrition services, yes, Senator.
we are not going to be cutting them.
Yeah, we do not anticipate a reduction in fiscal year 22 based on the extent of additional federal dollars that have been coming in during the current year. And frankly, that we also anticipate coming in the next relief bill as well. The reduction was about 300,000. The additional federal funding coming in thus far has been $7.5 million. So I think we're confident that the level of meals can be sustained through fiscal year 22.
Okay, thank you. Yes.
I would hope that we would add to our list to look at, in the omnibus, to look at the brain injury waiver waiting and to consider that issue at omnibus. So I know there's some work going on with that right now. A number? I do not have a fiscal note. Well, yeah, there's a big number on here.
Somebody for the brain injury waiver here that wants to speak to this item and give us some clarification on numbers?
Actually requested over 8 million in 2022.
Identify yourself, please.
Madam Chair, Mark Dugan, here on my own behalf, not on a part as a client matter. Specifically, I think the agency had 1.7 million identified in this fiscal year and 8 million in the next fiscal year. The agency has also recently presented the stakeholders with some policy changes that we think would more appropriately allow the waiver to be more of a rehabilitation waiver. There's currently 100 people on the waiver that have been on for over 6 years, 270 that have been on for 3 years or more, which I think, as you know, it's really important to get folks services right after an injury. That's the best time for the brain to heal with rehab and other services. And the fear, I think, if you don't do anything this session, is what you'll do is you'll create a system that perpetually makes it worse and is never able to solve, because the number will get so big, you'll then be bringing people on the waiver that have been on the waiting list for years, not able to heal. And so it will, if we agree that the numbers are large. We hope, if the agency's aggressive in quickly implementing those policies, that those numbers, the real numbers, will end up being smaller. So I appreciate your interest in doing something, whether it's an omnibus or really holding accountable the implementation of those policies and investing some dollars. Any other questions or follow-up?
Yeah, just say the numbers again. What?
I think it was 1.7 this fiscal year, they said.
21.
Yeah, and then 8 million in next year.
8.7.
And I don't think those numbers reflect the agency's proposed amendments and tightening up of the waiver. So ideally, if they hustled and got that done quickly, the reality numbers for fiscal year 22, I think, would be significantly less.
So is that being worked on about tightening up because it seems to be?
So fortunately, I think we saw a first draft of that the week before the budget hearings occurred on the waiver. I don't know what the timeline is on that. The secretary could speak to that. I do know the agency has had concerns about creating a waiting list since 2018. I know they've had proposals in front of them since 2019 to do these things. And so hopefully there's enough pent-up demand to implement those policies. It won't take a year or a long time to implement them.
Madam Chair, this is Secretary Howard. If I might, we've done some preliminary costing out of the savings that would occur from the policy changes. I mean, we still have some additional work of bringing stakeholders back to the table, but in fiscal year 2022, we believe the estimated shortfall from a state general fund standpoint would drop from the 8.8 million we originally requested to about 5.9 million. So about $3 million less than what you have in front of you. With the all funds number dropping from almost 22 million to just under 15 million. So about $3 million less than what you have in front of you with those policy changes.
Madam Secretary, would the 1.7 for 21, would that stay the same?
It would. By the time you move policy changes through CMS, it's a many months process. And so our assumption is approval of those policy changes by September or October to achieve the savings in 22.
Thank you.
I was going to do similar, but I was going to put the 5.9 that she thinks she can tighten it down to. And in the meantime, we're going to have another one of these subcommittees. I've been telling everybody I'm done with budgets at the end of this week. And so here we go. I thought I was done. So is that okay if we put the 5.9 in to review it omnibus, and then we'll have this meeting as well, okay?
Chair, could I ask a question? Maybe this is, I'm sorry. So the Secretary, about SB 123 treatment, I just had on my list about, and I always get confused, about looking at this in omnibus to see if any legislation passed. Do you know anything right at this moment, Secretary, on SB 123?
I don't, but I might ask, I know Commissioner Brown is on as well. I might ask Commissioner Brown if he has any update related to SB 123 legislation. I know there's been some proposals that would expand that population. Commissioner, do you have any more information on that?
Yeah, would the senator mind just repeating the question?
So my question was about the funding for SB 123 treatment, and I had made a note on my little list about looking at it at omnibus to see if there had been any legislation that had been passed this year dealing with it.
So there is legislation that I believe is being looked at. I don't know that I have seen anything passed yet. But my understanding is that there was an effort to expand the population to include pretrial diversion folks.
You have any idea where it's at? Does anybody in the room have any idea? Oh, I think that Stuart Little's in the room, and he has an idea of where this is at right now.
Thank you, Madam Chair. Stuart Little, Behavioral Health Association of Kansas. There's one bill has already passed. The pretrial diversion bill has passed the House. It's in Senate Judiciary. I think the chair is going to work it tomorrow or Thursday. And so you all should have it on the floor, and that's going to have the potential to expand somewhere between 25 and 50 offenders to several hundred, depending on what communities would take on this pretrial diversion. There's another bill that is on the House floor, I believe, next week, that will add further population. I put it in my testimony just to make sure that when we got to omnibus, if any of those bills had passed and added offenders to that program, that we would need to consider adding money. Otherwise, we're going to diminish the capacity for the program by adding more people with no resources to pay for it.
Thank you, Stuart. Madam Chair, do you want, can we add then to our list of in omnibus to look at if any legislation has passed this session to expand the population that would be treated under SB 123?
Put that in our notes. Okay, is there anything else? I'm sure we will know within 24 hours what all we missed, right? So I'm going to go down my list. Sarah Petty, you put in $3 million for the 988. 1.0 for the Ember Hope. 10 million for the nursing homes. 2.6 for the reimbursement rate for the TA waiver adjustment with our new study. 2 million for the community mental health grants. 250,000 for the SUD grants. 9 million in 2021 for the IDD and 12 million in 2022. The BI waiver at 1.6 for 2021. 5.9 to be reviewed at omnibus with our study. And then your mention of Senate Bill 138. Well, I have that down here. You had another one, 128.38 for the community mental health grants. You brought that up. That's part of the modernization.
Right, that dealt with your 250,000. SB.
Oh, okay.
38.
Okay, thank you. And then look at the 123 expansion. Correct? So I would suggest that when you receive this write-up from Matthew, take a good look at it and compare compare it to your notes. I did. That was the big one, ticket. So my rough estimate is 30 million. You add to the additions for the next year, for the following years, 47 million. Pocket change. Well, if you were the federal government, pocket change. I just want to make sure we have everything at least noted that you want in here. And then make sure you look at those reports after Matthew gets them done, before we report, and we report out Thursday? Anybody know? I didn't bring my calendar. I'm pretty sure it's Thursday. It's Thursdays. Yes, because they need 48 hours to do it. So that gives us time to take a look and make adjustments. All right. Anything else? Yeah. What I just shared. Here's my sheet. Okay. All right, I have a motion. Senator Petty didn't want to make the second because no one gets you in trouble. I'll make the second. How's that?
That's good.
Are you okay?
I did want to ask one question. We did have several requests concerning PACE, and we didn't have any conversation here about PACE. I just wanted to see if anybody can answer the question about what it takes to reinsert PACE into the consensus caseload process. That was one PACE issue. I mean, that was one in
You can
the
make
list.
that a recommendation. But you want to know the process, or how? Or do you want to make it a recommendation?
I'm not certain about who makes that decision about them.
Sure.
being
Hang on. Well, I want to go back to Matthew on that. We increased the protected income level, was it last year or the year before? It must have been the year before, right? And how much did we increase that the year before?
I believe it was increased to 150%.
Yeah. Do you remember the numbers, or do you just?
I don't have the numbers off the
Okay,
top of my head.
that's okay. But I think it was a significant increase. Yeah, it's over $1,000 now. So why don't we just put something in there to get some information of how to redirect the PACE programs to be included in the consensus caseload estimates. Would that be okay? To add that language? Did you hear that, Matthew? Okay, thank you.
And that amount right now is 1,177.
Okay, I think that's it. We'll see what that looks like, Matthew, after you figure out what we just said. It's even harder when you're on WebEx to interpret what we're thinking or looking at. So, anything else come before us? Not, we're adjourned. What?
Madam Chair, so do we want to mention that list of items to have this subcommittee study?
I have the brain injury waiver. You had two others. Do you have?
I had, the one I had was concerning child enforcement collection.
Yeah, but then you had one that's just today.
I don't.
You asked me about that one earlier.
Yeah, I mentioned this to you earlier, but I don't think I wrote down whatever you thought I asked for, so I don't know what it was.
We'll figure it out. Okay. Oh, I know what it is. It has to do with that waiver in trying to figure out how we can figure the savings from not being hospitalized. So that would be the TA waiver. Reimbursement rate. That was the other one. All right, anything else? Seeing nothing, we are adjourned. Thank you.